are you feeling, honey?
I'm feeling alright. A little nervous, but it's okay.
Nikki and Colleen are ready for you guys. Follow me.
Okay, thank you.
Dr. Grove will be with us in a moment.
Okay, thank you.
How are you guys doing today?
I'm doing good.
So, you're 8 months along. How are you feeling?
I'm feeling good. The baby kicks at night, but I feel well. There hasn't been any problems.
Well, that's great. Kicking's completely normal at this point.
We are both feeling a little nervous because we don't know what to expect.
What are you most nervous about?
My friends have said that I have nothing to worry about because my baby is already attached to me, but I'm not sure if that is necessarily true. Can you give me more information about this?
Unfortunately, that's not the case. In order for your baby to form an emotional attachment to you, he must first be able to recognize you. Recognition only occurs after having and remembering an experience with a person. And because your baby isn't born yet, he doesn't have any experiences to remember.
At time of birth, newborns have had no opportunities to experience touch, sight, or smell, and have had little to no experience with taste through amniotic fluid passing through your body and through sound waves passing through your body.
But can't he hear our voices when we talk to him?
Not necessarily, but it is possible. He may be able to hear you, but the sound waves would have to pass through skin, muscle, and body fluids to get to him, making it unlikely but possible.
Oh, well, that's disappointing.
Don't worry. Evidence suggests that infants learn their mother's voices soon after birth. Within 2 to 4 days, infants usually show preference toward their mother's voices.
Also, keep in mind, your baby will begin to recognize your smell after just a few weeks, given that you breastfeed, and that he will also begin to recognize your face after just a few weeks, and not only recognize it, but preference it to others.
Okay, that's good to hear. How can we be sure that he will recognize us?
Well, babies are only able to get a clear, well-focused image when objects are between 8 and 12 inches from their faces. So if he frequently experiences being held by you or Nikki, then he will start to recognize both of your faces.
Okay, well, that's good to know. Since we haven't had any experiences with each other, he is not going to be born already attached to me.
How are you sure of this?
Well, there are only 2 ways to determine if someone's attached to you, and those are if someone generally tries to stay near you, or if they show sadness or grief when they're not in your presence, which is really easy to observe in toddlers, but not as easy in newborns or infants.
Infants have no ability to try and stay near someone because they cannot walk or even crawl yet, so they indicate this by crying. However, usually when infants cry, it's due to physical discomfort. We know this because they will accept care and feeding from anyone, not just their mothers, when they're in need.
Why would our friends think that our baby would be born with an emotional attachment to his mom?
That's a common misconception because often the first emotional attachment a baby makes is with its mother. However, it's not born already attached.
Okay, well that is good to know before he comes. Thank you for clearing that up.
Yes, thank you so much for all your time and patience, Doctor.
It's been really helpful.
No problem. If you two have any further questions, feel free to give me a call or set up another appointment.
Have a great day, you guys.
Thank you.
Well, that was really interesting.
Looks like we were a little misinformed on a couple of things.
Yes, I can't believe it will take that long for our baby to form an emotional attachment to us.
Yeah, we should tell our friends so they don't misinform anyone else.
Do you think we should still talk to our baby?
The doctors say that though it's not likely, there's still a chance he can hear us, so I think it's still a good idea.
Yeah, I'm really glad we talked to our doctor.
Too. Some help?